is sponsored by Orthopaedic Associates of Muskegon. It's a part of the body we often take for granted, the foot and ankle, and yet experience an injury or develop some sort of medical condition, and you'll know how important it is to tend to problems of the foot and ankle. Dr. Brandon King is here from Orthopaedic Associates of Muskegon to talk about foot and ankle care. It's good to see you.
Likewise, thanks for coming.
Yeah, tell me about this practice. This is big and really diverse in terms of the ability to care for all kinds of problems, right?
Yeah, we can pretty much cover it all. We have multi-specialties, so we have orthopedic surgeons, we have non-surgeons, we have physical medicine rehab physicians, we have primary care, urgent care, we have everything.
When it comes to the foot and ankle, you also have everything.
When it
you
comes
can
to
treat whatever's happening.
Yep, so we have 2 board-certified foot and ankle specific surgeons. We're both fellowship trained. We can pretty much cover anything that comes up.
When somebody, and I mentioned it in my introduction, when you suffer from something in the foot and ankle, whether it's an injury or some kind of a chronic something, it can wreck your quality of life, right?
It certainly can. It could be as simple as wearing shoes. It could be doing your job, being on your feet all day. You name it. Participating in sports. There's a number of different conditions. One of the most common things in orthopedic surgery and in musculoskeletal is foot and ankle problems.
You are a surgeon, but you don't just do surgery here. You consider all options for treatment, right?
Absolutely. The last option should always be surgery. Physical therapy if indicated, the most minimally invasive thing. It's about developing a relationship with the patients and making sure that you're doing what's best for them.
People may come here through the ER, or they may walk through the doors with an appointment, right? You meet people where they are and based on what their needs are.
Absolutely, and also through our new urgent care. So our new urgent care, we get patients in all the time for ambulatory conditions. They may have sprained their ankle really bad. They may even have a fracture, but it's to the point where it wasn't a car accident or something of that sort, and we'll see them through the urgent care as well.
In terms of presenting with different kinds of problems with the foot and ankle, I mean, they may be, you mentioned the car accident, but it could be diabetes care, right? There could be a lot of different sources of trouble that may bring folks here. Describe a bit of that.
Yeah, it could be anything from diabetes management with maybe an ulcer that's not healing, an ankle sprain like I talked about. It could be something really chronic, like an old club foot even, that really can, it could be walking on the side of your foot and you don't have to.
Yeah.
We can fix that.
When a person comes here, you surround them with this team of experts that you've talked about. Talk a little bit about the creating a care plan around each patient, custom to what their needs are.
Yeah, absolutely. So my first goal whenever I meet a patient is to figure out who are they, what do they do, what are their expectations, what specifically can they not do, to try to figure out where we need to go with this. Usually it's not straight to surgery. Usually it's physical therapy. We have a full assortment of different orthotics, bracing, etc. right here. You don't have to go anywhere else. We also have the physical therapist just downstairs. We have the physical medicine doctors who can do EMGs or other workups as needed. We have the full assortment.
Yeah, which is really terrific, I think. A great selling point. Everything located right here. You don't have to go running all around town when your foot and your ankle isn't working right.
Exactly.
You can learn more about Orthopaedic Associates of Muskegon on their website. We have put a link to it on our site. Go to wzzm13.com. You'll find it there.